1. Boost your mental health with physical activity exercise for well-being. 2. Does exercise impact mental health? Unveiling the truth. 1. Boost your mental health with physical activity exercise for well-being. Imagine this. You're stuck in a dark room, and the only way out is to find the light switch. But what if the switch is hidden behind a complex maze of wires and circuits? This is often the reality for those navigating mental health challenges through psychotherapy. But here's where it gets controversial. What if the path to mental well-being isn't just about therapy sessions and medications? What if the key to unlocking your mind's full potential lies in something as simple as physical activity? Let's dive into this fascinating connection and explore how moving your body can transform your mind. In the world of psychotherapy and mental health, there's a common focus on techniques and tools designed to equip patients with the resources they need to manage and resolve their difficulties. However, a truly effective path must consider the whole person, not just the patient. This means evaluating a wide range of life areas that might not seem directly related to the presenting pathology. Lifestyle, food habits, sleep-wake rhythms, hobbies, and recreational activities. All these elements are crucial in structuring a personalized therapeutic journey. Cultivating a healthy lifestyle is often a primary goal in psychotherapy because mental health and physical health are deeply interconnected. Educating patients about good habits in managing sleep, food, and physical activity can be a powerful starting point for building a comprehensive therapeutic path. This approach helps develop functional resources that promote overall well-being. Now, let's zoom in on one aspect that's gaining significant attention: physical activity. Scientific studies have shown that exercise doesn't just benefit your body. It has profound and lasting effects on your mental health. But what exactly do we mean by physical activity? Physical activity encompasses any bodily movement that expends energy. It can be structured like sports or workouts, or unstructured like walking or doing household chores. It's a broad concept that includes a variety of activities, regardless of their specific purpose, intensity, frequency, or duration. Think about it: running, swimming, dancing, gym workouts, playing sports, or even cycling. All these activities fall under the umbrella of physical activity. It's important to distinguish physical activity from motor activity, which is more specific and refers to all voluntary or involuntary body movements involving fundamental motor skills. Motor activity is often focused on learning, development, and improvement of motor skills in educational or therapeutic contexts. And then there's sport, which is a highly structured form of physical activity with rules, objectives, and specific preparation. The impact of physical activity on managing anxiety and stress is well documented. During exercise, your body releases endorphins, often called the hormones of happiness. These neurotransmitters improve mood and reduce cortisol levels, the hormone associated with stress. This is why physical activity is a key strategy in many therapeutic protocols for managing stressful situations. For example, dialectical behavior therapy, DBT, for borderline personality disorder includes intense physical activity as a regulation strategy during crises. Research has shown that regular physical activity can reduce symptoms of anxiety and stress, increasing psychological resilience. A study by Herring et al., 2014, found that aerobic exercises like running or swimming can significantly reduce anxiety symptoms, even in individuals with generalized anxiety disorders. And this is the part most people miss. Physical activity isn't just about managing stress. It's also a powerful tool in combating depression. Depression is incredibly common, affecting 10% to 15% of the general population. While exercise can't replace psychotherapy or medication, it's recognized as an effective complementary intervention. A study by Blumenthal et al., 1999, showed that aerobic exercise can be as effective as antidepressants in reducing depressive symptoms, and in some cases, it has more lasting effects, especially when practiced regularly. But here's where it gets even more interesting. Physical activity also plays a crucial role in protecting against cognitive decline and neurodegenerative diseases like Alzheimer's. Regular exercise improves blood circulation to the brain, promotes neuroplasticity, and boosts the production of neurotrophins, proteins that support brain cell health and growth. Studies such as one by Norton et al., 2014, have shown that exercise can reduce the risk of developing dementia and age-related cognitive decline. It improves memory, concentration, and emotional well-being, and it helps combat social isolation, which is often a factor in cognitive disorders. The World Health Organization, WHO, recommends that adults and those over 65 engage in at least 150 minutes of moderate physical activity or 75 minutes of intense activity per week, in sessions of at least 10 minutes. However, recent recommendations suggest that even short sessions of physical movement can be beneficial, counteracting a completely sedentary lifestyle. So, how can you integrate exercise into your daily life? It doesn't mean you have to become a professional athlete. The goal is to find activities that you enjoy and that fit your lifestyle. Whether it's a daily walk, a yoga class, or a gym session, even small amounts of physical activity can have a positive impact on your mental well-being, especially if practiced regularly. Physical activity can become a valuable resource for managing difficult emotions and situations, helping to restructure daily habits and create positive cycles aimed at promoting psychological well-being. And this is the part most people miss. The benefits are even greater when you practice physical activity in the company of others and in contact with nature. So, grab a friend, head outdoors, and start moving. Your mind will thank you. But let's spark some debate. Do you think physical activity should be a mandatory part of all psychotherapy programs? Or is it just a nice addition? Share your thoughts in the comments below. Let's get the conversation started. 2. Does exercise impact mental health? Unveiling the truth. Have you ever wondered if exercise truly enhances mental health? It turns out that the way, place, and motivation behind your physical activity might be more crucial than the amount of exercise you engage in. While exercise is commonly associated with improved mental well-being, a recent study from the University of Georgia sheds light on the importance of factors beyond just moving your body. Researchers suggest that the mental health benefits of exercise heavily rely on the environment, purpose, and social aspects of the activity. Instead of solely focusing on the duration or intensity of exercise, it's essential to consider whether you're working out with a friend or participating in a game. Recreational activities like running, yoga, or cycling for pleasure are often linked to better mental health. But the impact can vary based on who you're with, the location, and your motivations. The study explored 3 types of research: broad epidemiological studies, randomized controlled trials, and studies emphasizing the role of context in shaping mental health outcomes. While regular leisure time physical activity is associated with reduced levels of depression and anxiety, the context in which the activity takes place is crucial. For instance, the same exercise can have different effects based on the outcome and social dynamics involved. Adopting a consistent exercise routine has shown to boost mental health, especially for individuals with pre-existing mental health conditions. However, the results of these studies may not be applicable to larger and more diverse populations. The key takeaway is that it's not just about the physical movement. The context, meaning, and experience surrounding the activity play a significant role in determining its impact on mental health. To truly understand the relationship between exercise and mental well-being, researchers emphasize the need for larger, longer-term studies that consider the broader context of physical activity.